Hello, and thank you guys for joining today. Today we're going to talk about it. We're going to get into it. It is name it and claim it. I know a lot of you guys have heard that. You have used that phrase. And a lot of times when you say it, you are thinking about things like, I want my health. I'm naming and claiming that. I'm naming and claiming money and success and all that stuff. But there's also another phrase that's out there that's being used, and it's, I'm not claiming that. And that comes with, especially like a certain diagnosis, whether it's high blood pressure, diabetes, cancer, any of those things. It's like, I'm not claiming that. But when that happens, unfortunately, I understand where you're coming from, but sometimes it can lead to claiming you. That thing, high blood pressure, diabetes, can end up claiming you because you said you didn't want to do the things to try to get it under control. And so we are just going to talk about that today. Today is a safe space. Today, we want for you guys to talk to us and kind of give us your experience and what you have, experience with this. If you've used the phrase, if you know someone else who has used the phrase, I also want you to drop that in the chat. But we're going to talk about it. We're going to unpack it. We're going to talk about what happens when we do that, but what also can happen when we start to make like a mind shift change so that we can have some better health. This is Lessons Beyond the Stethoscope, where we provide practical health tips and tools that you can use in your everyday life, because what we understand is that your life affects your health. I am Dr. Ashley Booth. I'm a board certified family medicine physician, and I am your host on today. But I am not alone. But before I introduce our guests, I want you guys to be sure to subscribe, follow, share, like, comment, like all the things that you know what you can do, because it's absolutely free. You don't lose anything, but you have a whole lot to gain because, like I said, we're putting out practical things that you can do that can truly transform your life. So go ahead and make sure that you do all of that stuff. But I'm going to talk about our guest in a second. This is episode 22. You don't have to claim it, but it will claim you. These are some steps to wellness and healing. And today, joining us, we have Dr. Kendrick Bailey. He is a friend of the show. He has been on before. He is a licensed professional counselor, and he's the co-owner of iProgress. He's also an author of a book that we did a giveaway on, that was a journey to healthy relationships, healthy you. And he is absolutely committed to helping people on a journey to self improvement and developing innovative strategies for emotional wellness. So, thank you so much for joining us today, Dr. Bailey.
Thank you for having me again, Dr. Booth. I'm excited about our conversation, and so I hope everyone just strap in and get ready to have a good time.
I know, right? Because this is the thing, it kind of picks up from our last discussion. We talked about emotional wellness, we unpacked what that was. I'll link that whole show so people can kind of pick up on that. But there was one thing that you talked about, and we didn't get a chance to fully kind of pull it out. And I was like, you know what? I think that would be good for the show because I knew what you meant when you said it, but I was like, some people can like take this and like run away with it and be like, I'm gonna use that because I'm not claiming it. But your thing that you said was you are not your diagnosis. Like
Mhm.
explain that to us. Like what does that mean when you say that?
So a lot of time in our professions, we get labeled with diagnosis a lot of time for reimbursement or for payment. And what I tell people, your diagnosis is a part of you, but it's not the whole part of you. It doesn't. Um, so don't wear it like a merit badge. These are some things that you experience. However, once you get educated behind what you're experiencing, there's many ways to manage and not look like what people may diagnose you with, because we always put labels and people think diagnoses are bad things. However, it's just an awareness of things that you present with. And once you know what you present with, you know how to combat it, you know how to manage it. And no one can tell, from how you walk or how you talk, what your diagnosis is. Now, if you showcase that and tell everybody, you know, I'm diagnosed with anxiety, I'm diagnosed with PTSD, then yeah, they know. But nobody can know what your diagnosis is just by seeing you. And so I think it's healthy for us to get educated in what we experience, but not look at it as a that's the end of our life type thing. And we have this spell casted on us, and we won't be able to survive and thrive in life.
And to me, that also goes back because I know how you said like we use these labels because we have to figure out, okay, this is what you have, because that also helps us figure out like what we need to do, right? But there's another piece of that, and I had an attending to help me understand because there is like this labeling, and they said one time in their profession they used to say the diabetics,
Mm.
those are the diabetics, right? So they just lumped all these people in a group. But then they said when I did that, I started to think of like them as diabetics and having diabetes, and like that's just who they are, versus that is just a disease that they have. So then they say
Mm.
they switched to saying I have a patient who has diabetes,
Yeah.
instead of just saying, oh, these are all the diabetics, right?
Yeah. And so that's having, compassion. That's the humanity in it. Because sometimes when we just look at people for what they're dealing with or what we're treating them with, then sometimes we just treat a problem. But if we look at the individual from a holistic perspective, we look at them spiritually, mentally, emotionally, physically, relationally, financially, and purposefully, we can show them that they have so much more to offer just than the one thing that they may be experiencing that they may call negative or aversive. And so it gives people a chance to take a really good look at themselves in the mirror and not settle for less than what they were created for, but also not look at themselves as less than just because they may be having a moment in time or in their life where they're dealing with some circumstances that may be overwhelming. So you're not your diagnosis is not just because we are overwhelmed or we may be struggling at this point in time. That doesn't always mean that that's going to be who we are for the rest of our lives, who we are 3 months from now or 6 months from now.
That's good. And I'm gonna come back to that. I'm gonna put a pin in that because that is like something that I want to continue to unpack, like how once you have that awareness, how that kind of unfolds and kind of moves you through that process. But one of the things I want to talk about too is like there is a difference between like being and accepting, right? Because like
Mm.
you can you can like you said, because we have these labels, like I can be a diabetic or I can accept that I have diabetes. You see
Mm.
what I'm saying? Like it kind
Yeah.
of shifts it and changes a little bit. Like what are your thoughts on that?
So one, I look at it. One says I have no control. One says
Mm.
I have the power to change my circumstances. So even though I may be experiencing diabetes, there's still things that I can do that can change how I experience it. I can eat a little cleaner. I can drink more water. I can exercise. I can go to my doctor and get advice from them. So it's a number of things that I can do to mitigate how this label impacts my life. And so that's the important thing that I want people to understand. There's things that we could do to mitigate the impacts of what we experience. But that's why we have to get educated. That's why we have to trust people in our system or community to help us. And by finding the community to help you, then you have someone to partner with you to help you plan how to overcome or manage these concerns. Because you always hear about, individuals that experience diabetes, sometimes they stuff get reversed because they change their lifestyle. And so it's the same thing from the emotional and relational and mental aspect as well. I may be experiencing depression and anxiety, but what am I going through that led to this? Am I overwhelmed at work? Did I suffer some type of loss? Did I experience some type of hardship? Do I have community around me? And by examining those things, we get a chance to identify what we're deficient in. And so, if we're deficient, how can I nourish myself with putting myself in the right environments to get what I need?
Man, listen, I'm over here taking notes because I was like, you touching on some stuff. I'm like, I don't want to get there yet because I want to. I want to talk about some of those things. But you are absolutely right, because it does help for you. Like when you touched on partnership and being able to have that trusting relationship, that is something that I harp on and I talk about a lot, because one of the things that I know that I know that I know, one piece of you truly getting the healing that you absolutely need and deserve is if you have partnered with somebody who makes sense for you, with somebody who can help you understand what's going on. Because I've had plenty of people who come to me and they say, that doctor did nothing for me. I'm like, they ain't do nothing. And they're like, no, they did nothing. So I was like, okay, well, this is what we're going to do. This is why we're going to do it. This is how it makes sense to me. Does that make sense to you? Do you want to do that? Oh, yeah, that makes sense. I get the notes back from the old provider and I see that it's a lot of the same stuff. But I'm like, well, why didn't they do it? Because they didn't partner with them. They didn't trust them. It didn't make sense. Something in that process, it's like one of those things, and they said, okay, I'm not going to do that. But that is a great point to say, in order for this process to happen too, it's not just, and I like that you said that, it's not just the person, it's like a community effort. And you have to partner with other people to get what you need so that you can go further. That's really good.
Yeah, it's getting back to the village mentality in
Yeah.
everything. So the village of the community mentality in everything. So, I think what's happened to a lot of people in life, if everybody tries to carry everything on their own, and what they realize is that's possible, for a certain amount of time, but long term, that weight starts to break them down. And when weight starts to break you down, you see it in different areas. You see it spiritually, you see it emotionally, you see it mentally, you see it physically, you see it relationally, you see it financially, and then you see it when it comes to people's purpose. And so that's why I encourage people to look at change and look at life from a holistic perspective. Never look at things in one way or one dimensional, because there's so many different ways to address things. There's so many ways to resolve issues, and if we just tackle it one way, we may be missing an opportunity to connect with other people, to gain invaluable resources or knowledge on how to overcome things.
Mm. That is a great point. Now, the other thing I want to ask you about was, when someone says, I don't claim this, what are you thinking from like your perspective? What does that mean? Translate that? Because I know what I think when as soon as I
Yeah.
hear that, I'm like, mm-hmm. But from you, from your perspective, like what do you hear? What does that say to you?
In my profession, I immediately go to the word denial. And so denial in anything that's unexpected, or anything that can be challenging or bad, you know we don't want to accept things. We can be in denial, but being in denial don't make it not real. It doesn't make it go away. And so we can't magically just say, I don't have this, and it goes away. Sometimes acceptance is what allows us to heal, and what allows us to get to where we're looking for in life. Because as long as I'm in denial, it's plenty of people that I've seen that's been in denial from emotional and mental things, and it's gotten worse. And then on the medical side, you've probably seen people that's been in denial about things, and they made things worse. So denial only prolongs the process to getting better. And
Mm.
so acceptance, gives us an opportunity to develop a strategy on how we're going to attack or address anything that we may be experiencing.
The other thing too, because the very first thing that came to me was denial, and I like how you said denial also kind of prolongs the process because it's still there, it's still happening. It's just the process is just going on a little bit longer. And I want for you guys to stay with us here, because this is the uncomfortable part of it. This is the part that we don't really want to face. Because, and when I say we, I'm talking about myself, because along with denial, there's other things that are in there like fear. Because one of the things that I have seen a lot is that you have probably seen a family member get that same diagnosis and you saw how that turned out.
Yeah.
So it's like, well, they got that. My grandmother had diabetes and she had to have amputations, or she went blind, or she had a bag full of medicine. Like, your mind automatically starts to go to that, which you don't want. So then you say, oh, I'm just not going to claim that, which I get. I understand. I'm not going to claim it because I don't want for this thing to happen to me and for me to have the same outcome. So then there's like some fear that's in there. There's like this resistance that's in there. But at the end of the day, like you said, if we don't start getting to the point of acceptance and start seeing it for what it is, then we can't start making those changes and start putting those things in place to say, okay, this is what they told me. And then now what can I do about it?
Yeah. And then everybody experiences things differently. The
Hmm.
way my friends or my grandparents experience this, it doesn't necessarily mean that I would experience it the same way, because technology, resources, science, all different things have gotten better. So it's more advantageous for us to address things when they first happen versus if we, wait till it becomes more aggressive, and it's at their worst, then it takes longer to kind of manage it and overcome it. So I always encourage people, get that community, establish that village, but partner with a provider that you trust. But the next step is, make sure you practice the things that they discuss with you, so you can get better. Because I
Yeah.
tell people all the time, I don't have the power to change people, but if people listen to the things that we discuss and they use them or implement them in their lives on a daily basis, they will see some type of change. And that change is typically productive because they change the way they see things, they change their perspective, but they also change how they do it.
And you are right about the change of like technology and time and the way things are done. So that's another good point about that, because I have quite a few people say, "Well, I don't want to do that because um, this is the outcome that I saw with a family member or whatever." Right? And I was like, I get that and I understand it. And then I have people, and I know if they tell me, I know they tell you, I don't like to go to the doctor. I don't like
Mm.
being, I don't like being here. And I said, I get it. I understand, because behind that, that tells me that there's some trauma there, because
Yeah.
someone didn't have a good outcome somewhere. And this is not supposed to be a pleasant experience. Now, I get it. A lot of times you come because something is wrong. A lot of times people come because they're sick. And unfortunately, some people have come because they were really, really sick. And so when they get this diagnosis, it's pretty advanced and all that sort of thing. So you've seen what happens. But it goes to a point of that still doesn't mean that that has to be you, because things have changed, technology has changed. There may be some better interventions that are there that your grandmother or whoever did not have access to. Yours may be your body may be made up differently, yours might be different, you may have caught it earlier, so there's some other things you can put in place. So um that's a very good point to make about that, so people can understand that yours still could be different. That's another reason why your outcome can be different. But the other thing I think about, and you said this too, about why people don't accept the diagnosis, is because they may feel like they are less than.
Mm.
And there's also like a vulnerability piece to it, because you have to accept that something is not, you are not all the way, I guess, like well or whole or whatever. So you are less than whoever else, because for whatever reason society has painted this picture that we are all supposed to be perfect, and we never supposed to have any issues. But talk about that part, that feeling less than, and how that can also be like a an obstacle that people will have to deal with.
Yeah, so there's all type of stereotypes out there about, physical and emotional and mental wellness, or health. And sometimes when we experience things, sometimes we think that we're less than because it may put the term on us as being disabled, or it
Mm,
may put the term on us that we're not as credible, or we're not as intelligent, or we're not as important. And so, just because we experience things, how you value you determines how other people value you. Because, and the reason I say it that way, because if I value me, I won't, tolerate and accept anything less than how I see myself. But if I don't see myself in a positive way, or I see myself as less than, sometimes I receive less than appropriate accommodations toward me. And so, how I see myself determines how I partner, or how I let people help me too. And then it also determines where I go next. And so that's why we have to have awareness is always the first step of change. We have to be aware of everything we're experiencing. And we have to know what perspectives we have, but also how to get understanding from other people on what's best, from for our lives versus the expert, practitioner experience, and then what we can do on the other side as the person that experiencing this daily journey. So awareness is always important, and then silencing the parts of yourself that have the doubt, that's the inner critic, and that tell you that if you accept whatever said label or diagnosis, then you will end up like everybody else. There's no correlation between, hey, you got this diagnosis, you're going to be at the bottom of the totem pole.
mm. I need you to say that one more time because I don't know. That I think is like the key to unlock a lot of things is that there's this inner thing that is saying that because for whatever reason, if I have this diagnosis, then this must mean this. And then that means that I'm less than, and that means that blah, blah, blah. So it just causes this whole cycle. Just like you said, if it's a physical thing, if it's a mental thing,
Yeah.
if it's a spiritual thing, whatever, that changes like how you are going to move. So tell that piece again. Say that part again.
Yeah, just because we're labeled with something, it doesn't mean that it's a sentence on our lives long term, and that we won't ever recover. Because there are many people that experience hardships, trauma, pain, and adverse circumstances that went on to do phenomenal things. And if we see ourselves like those people, then we start doing the things that they did. But if we see what we experience as a terminal, illness or terminal sickness, then we start to sometimes behave in that same manner. Sometimes we give up. Sometimes we have no hope. We have, you know, we get into a depressive state, or we let what we experience, be the dominant posture for our lives. And that's absolutely the wrong answer. Nothing that you're diagnosed with should be the dominant posture of your life,
Mm,
because every day we get a chance to celebrate something. And what better way to start life or start each day than being thankful, celebrating another chance to do something great, but also educating people on how you overcame things instead of how things overcame you. So it's
right.
just a flip of the script. Instead of talking about how things overcame us, we talk about how we overcame the things that would, put in our ways as obstacles.
Right. Oh, that's so good. I love it because I know the reason I was like, we just have to say it again because I think that's one of the biggest things that keeps people like from like truly accepting. They're like, yeah, I know what you're saying, but I'm still not gonna claim it because then da da da. And I just know where that narrative can lead us. But when we do that, and you touched on a little bit, like some of the consequences that we know of what happens when we don't fully become aware of it or we don't accept what it is, and we don't accept that, then a lot of times, and I've seen it, then we have you're not making those informed decisions, like you said, because you're not aware, you're not doing the things that you know that you're supposed to do, or you let this thing overcome you, and then essentially what happens is it's just poor health, poor outcomes, and that thing that you didn't want is like now starting to consume you. Can you talk a little bit about that as well, like how you see it from your perspective and in your practice?
Yeah, so I work in my practice. I work a lot with people with anxiety, depression, PTSD, or just people in general just dealing with maybe some phase of life concerns, or they may just feel like they don't have the answer to what they're experiencing. And so what I do is I focus on helping them understand how they got to where they are. And so again, awareness is the first step of change. So you just didn't develop this way today. There's been months, years of things leading up to what you're experiencing now. And sometimes what people are experiencing is just being overwhelmed with having to be the fixer in their life, and that has a lot to do with control or not trusting other people to partner with them. So it's not that we don't have a lot of people that's willing to help us. A lot of times we don't want to receive the help because how help may make us look. And so you see it in your practice. Sometimes people don't want to come to see the doctor because then that means something's wrong, and then I don't want to be labeled as something wrong. So when people come to see me, the first thing they say, I'm not crazy. Well, I know that crazy people don't come to therapy. you know um, People are proactive most of the time when they come see me. They understand that they want to address some things that maybe have gotten out of hand, and then I normalize it. Okay, so a lot of people experience what you experience.
Mm,
Are you willing to be consistent in doing the things that state that you want to change in therapy? Because that's the biggest gap with therapy. What people say in therapy versus what they do outside of therapy. 90% of what happens in people's lives happen outside of the therapy session. So if we come up with the formulations and the address things in therapy, what you do once you leave has the biggest impact on change, because you got to go back to those environments. You got to go back to managing everything on your own. You got to find the resources that we discussed. you know and so I think partnership is powerful in every aspect of life. And once we learn that we don't have to tackle certain things on our own, and we don't have to be the person that has to be the expert 100% of the time, and
mm,
we're more likely to trust people that have something that we don't know, then I think it's better. The hardest person to help is the person that knows all the answers but won't do anything about it. That is the
mm.
hardest person to help. From and I'll be willing to say on the medical side, and as a provider and as a therapist, those are the hardest people to help. That know the
Yeah,
answers but just won't follow through with them, because
yeah.
you
No,
have
go
to,
ahead, go ahead. That's true.
you have to believe, and you have to have buy-in that what you're doing will yield the results if you're consistent.
Mm, yeah. And what I like that you said, and I wrote it down because that was one that, I mean, like we're on the same wavelength today, because I was going to say about normalizing. Like once we get to the point that certain things are normalized, like there was one thing that I saw with a friend of mine, their child has type 1 diabetes. Okay, they normalized it. Like she would sit at lunch and do her insulin. It's no big deal. And people were just like, oh, okay, that's just what we do. It's not like, oh, I'm shame. I can't, I have to. She was like phenomenal doing all these other things, very active, would have her little her thing on to check and make sure everything was monitored appropriately. It wasn't like everybody's looking and like, oh my gosh, what's wrong? It was like, oh, this is just what we do. I'm still fine. I'm still healthy. I'm still able to do what I need to do. But it was normalized. So nobody looked at it like, oh, like what is happening? They normalized it themselves and said, this is how it is. This is how we're going to approach this. This is just life for us and how we're going to do it. And everybody else just got on board and was like, oh, okay. This
Mhm.
that's just how it is. And I think that's how we have to start approaching a lot of these other things. Like you said, like I'm gonna normalize taking my medicine every day. I'm going to normalize doing some of these other things that I have to do to make sure that I get these things under control, because just because I've been diagnosed with something doesn't mean that I'm not able to like normalize and say, okay. And like you say, you also we also don't have to go out and broadcast to everybody that, oh, I have so and so, and then have this label put on. But if you just move in a way that, yeah, I just took my medicine, it's no big deal. Everybody else will kind of like follow in line with that. And I was thinking about just like the benefits of accepting the diagnosis too, because you mentioned being proactive. And so I was going to talk about that too. It's like now you can do something about it. You can go and make this appointment. You can go and do the checkup. You can get a second opinion. Like it's being calls being informed. I've had several people who say, I'm not claiming whatever. I get it. I understand. Well, then do you want to go, especially if it's I send them to a specialist and that's what the specialist said.
Yeah,
Okay. Do you want to go to see someone else so that way we can confirm that this truly is what it is so we can figure out what to do? Once you're open to that process, then we can start to see, okay, what do we need to do to put in place? So I appreciate you bringing out both of those points, like normalizing it and being proactive, because I feel like those are some key steps. What are some other things that you feel like is like a benefit of just like being aware and accepting um, what you have, like accepting that diagnosis?
a lot of time it leads to a more life satisfaction, because
Mm,
sometimes people go through their life looking for the answer to what's wrong, and I know something wrong with me, but nobody ever told me nothing
mm,
was wrong with me, and then they find out and they accept it, and then they go on and find out how to address it. One of the things I talk about is like adult ADHD. People have gone through their entire childhood up into early adulthood, and sometimes even into later adulthood, and realize that their issue with concentration and focus was ADHD. And then that's another thing that I talk about with kids or anybody I treat. A lot of people look at that diagnosis as something negative. We as people in society associate a lot with behavioral problems, but that's not really what it's about. Imagine having 1,000 things going through your mind at once, and you trying to filter out all the things that you're thinking about just to focus on the one thing that you're supposed to be focusing on. And sometimes, some people describe me to that's what it's like. And then if you're easily distracted, people may think, hey, this person not respectful. It's not what it's about at all. It's about how do I deal with this beautiful mind of mine, and how do I learn how to shut off all the different noise or chaos, just so I can win at the things that I'm trying to attend to. And looking at things from their perspective is one of the things that clients really appreciate and enjoy, because now they say, you see me, now you understand me.
mm,
Well, the only reason I can see them and understand them is because I listen to them, and I stop looking at everything what the book says, like a junior woodchuck. The book says this, the book says that. Well, the book can never teach you how to deal with real things.
mhm,
The book is just a way to deal with things, or a way to experience things. Sometimes providers have to shut off the robotic part of themselves and learn to operate from the humane part of
mm,
themselves, and listen intentionally, so they can partner with people. And that's why some clients, you can tell them the same thing 10 times, but it's how you say it. It's your tone, it's your technique, and it's if they feel like they was joining with you in the actual experience. And
mm,
if I don't feel like um, I've joined with someone, even when I go see the doctor, then my experience, is going to be a less pleasant one.
mhm.
Because to me, they're just going to be going, I'm just a number, instead of I'm someone that is occupying 15 to 30 minutes of their time.
Right. And that's important. The other thing that you said that I remember someone else had touched on too, about if you've had something for so long. The other reason I feel like some people are battling and struggling with a lot of things is because someone else may have said, I'm not claiming that. Like if you have adult ADHD, unfortunately, a parent, a guardian, or someone may have been told about this earlier. And they said, well, I'm not claiming that for my child. My child does not have that. And I've even
Mhm.
had some parents who said, my kid, I know that they told me that, but I was like, my child doesn't have that. And then as their child got older, they're like, you know what? I think they did, but I just didn't want to see it, or I didn't
Mhm.
want them labeled, or I didn't want them to be on the medicine. Whatever it is, they didn't want, but now they're starting to see the effects. It's affecting their relationships
Mhm.
with the parent and child, the relationship the child has with their teacher or with their classmates because they are not able to kind of focus like you said, and they're kind of speaking out of turn. And some people may now say, oh well, now this kid is rude, this
Mhm.
kid, you know what I'm saying? Like you get all of these extra labels on there. And I like how you said that once you finally get the awareness for yourself. So some people know that you may not have named or claimed something and say, oh, I didn't claim it. Someone else may have done that for you, or someone else may put that in your ear and say, well, we don't claim that in our family. We don't, whatever.
Mhm.
And then that kind of hinders you. But once you get this awareness and see, okay, maybe I do have this, it kind of opens your world because you have these tools that you can use to really help your life get better. Like you said, you work with people who have adult ADHD, and now you're able to, they're like, you see me, you
Yeah,
get me. Now you can help me work through this thing and figure out how to get my life together, right?
yeah, and a lot of that is it I associate it with freedom. So
Mm, mm,
so what we're really telling people is when we on a bigger scale, when we say I don't accept or I reject these things, we tell people, if, especially if it's our parents or people connect to us, that it's not okay to experience what you experience. And
mm,
so, what other things are they rejecting and refusing to accept that they could have, actually gotten help with, or they could have actually partnered with somebody and they've gotten better? You know, a lot of people related to us, parents, a lot of times, say that we're not going to do this. And what I try to point out or paint the picture to is we're causing someone to go through life and to struggle in an area that they could actually, win at a better rate. But because we
mm,
choose to deny them of that right to address these things and someone to hear them, then they get to struggle. Just
mm.
because my parents struggle with something doesn't mean that I'm supposed to struggle with it too. Because if we break patterns in life, that means we learn the lesson. If we don't break patterns, then we can continue to repeat the same lessons over and over until we recognize, oh, I probably do this. And that's a lot of what I see um, in my practice, but also in family sometimes. So we got to be more forthcoming about talking about our experiences, because even if we don't tell people about what we experienced, they still will know because it'll play off in other people. And
Right.
so why let them struggle with this, chaos? Why not partner with them and let them know, hey, this is what's going on. This is why I do these things. It may be anxiety. It may
Right.
be
That
it may
is
be other things.
That is so, 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 so good because you're talking about when you said breaking patterns, that started to get me to think about what I've been harping on here lately. And people are probably going to get tired of me talking about it. But I've been talking about generational health. I was like, everybody's talking about generational wealth, but I was like, in order for us to truly achieve generational wealth, it starts with health. Like
Mhm.
people have to be healthy. And in order to be healthy, just like you want to learn about the stock market, you want to learn about investing, you want to learn about how you can put your money in different places so that you can have all these things for your children and your children's children. You got to start learning things about yourself. You got to start learning things about your family. And so having those conversations, talking about family history, who was diagnosed with what, and
Mhm.
what they do about it, so that now you can say, okay, this might be coming down the line and I need to be aware of it so that I can now do something about it. And then,
Yeah.
like you said, the biggest thing from it is freedom. Like,
Mhm.
you're not going to have to struggle with this. Like, how nice and beautiful, like, just sit with that. Like,
Yeah.
how nice and beautiful is that to know that your family does not have to struggle? We think about struggling financially, but struggling with their health, with certain things that you're like, so and so had this, and then now so and so has it, and then so and so has it. But you can like break that because you say, this is not going to claim us, and it's not going to claim us because we're going to do something about it. Like, oh my gosh,
Exactly.
it was so good.
And I see it a lot with men too. You know,
Mm,
I'm 41, so when men hit the 40 number, that's when a lot of times we want to go start, seeing doctors, seeing providers, getting our health in line. But sometimes is when we don't. And so, really breaking that stereotype and stigma with men about their, you know, emotional and mental health as well as their physical health and seeing their providers because, you know, if you don't go see something that you may, think is a problem now, 15 years from now, something like I said that could have been addressed. Now it's out of hand, and
mm,
we got to feel empowered enough, courageous enough, and uncomfortable enough. And no, and I didn't say
mm.
comfortable. We got to feel
Right,
uncomfortable enough to still go have the discussions and conversations that we don't want to have, so it can lead to the readiness and preparation of things that we experience, and it can lead to better results. Because think about how many things over the years that men and women experience had they just gotten checked, had they talked with someone. Sometimes is the lack of knowledge, sometimes it may be the lack of resources, but the lack of knowledge is the reason for not doing a lot of things because again we think something is bad when actually knowing the answer is good.
right, right.
I much rather
That's
know I have anxiety than not know I have anxiety, and I just wonder why am I checking the doorknobs?
mm,
Why am I getting so irritable and anxious? Because a lot of anxiety um, resembles anger, and if you don't
mm.
know that anxiety resembles some of the same emotions that anger has, then people just think, "Hey, I'm angry. I need anger management." No, you need to understand that this is anxiety, not anger.
Yep. That's the good part. That was that piece that puts together about what you saying, having an expert opinion to be able to talk to them about something. Because the other thing that happens, and I saw this little TikTok that was absolutely hilarious to me, was about people sharing medications. Oh girl, I have so and so, I got some extra medicine. Come on over and get some. But it's about, because your friend thinks that this is what you have, so this is what you should do about it. It might be what you have, but that might not be like what you should do about it. Like, having a sit down discussion with someone who can fully help you flesh it out and say, okay, this is what's going on and this is what we need to do. Because you're absolutely right. I have the discussion all the time. People will tell me some of their symptoms and I was like, okay, like, and we're about to have an uncomfortable conversation. Has anyone ever talked to you about depression or whatever? Because this is what this is starting to look like. Like, you're getting up every day and you don't feel suicidal, but you have all these other symptoms that are starting to take over. And that's still depression. And they're like, what? I thought it was just people who laid in the bed all day. I was like, no,
Yeah.
there's a lot of people who are getting up every day, but they have some other symptoms. So I appreciate you pulling that out, because that's really key and important. The other thing I wanted to just kind of make sure that we wrap up and let people know is just health in general, because our whole purpose is for people to get like health and wellness, and to make sure that they get it in whatever form that it looks like, because you can be healthy and take medication.
Yes.
You can be healthy and go to therapy,
Yes.
right? That's right.
Yeah.
Because the thing is, what I realized, and I pulled it up and just Google it. Google health definition, and it will tell you it is a state of complete physical, mental, and social well-being, and not just the absence of disease. So you can be healthy and take that medicine. Because I have a ton of people who say, "Well, I'm getting off of this medicine," because to them, getting off the medicine means that they are healthy.
Yeah,
And I said, "Well, if that medicine is keeping things under control, then that means that actually the medicine is helping to make you healthy."
yeah,
So talk to me, and everyone about that. Like health can look different ways, even if you have to go and see someone like you or like me, you can still
yeah.
be healthy.
We got to look at our health. Our health is, you know, is more important than money, because if we were dealing with something terminal and we had the money to get rid of it, we most people, it may be some outliers that wouldn't choose the help, but most people would choose the help. And so we got to look at health from a preventive maintenance standpoint. We got to, and then health is about progress. So one thing I want to share: progress never stops. See, when we get better, we often stop. Progress is constant, and we should never stop, because there's different levels to health and wellness. And as long as we're pursuing healthy goals, as far as what we do, whether it's what we eat, whether that's I always tell people they need to develop a personal wellness plan for their life. That's one of the first things I do. And when they first appoint me, hey, we need to develop a personal wellness plan, because I need to see what you're doing when you're not working. And if all your life consists of is work and sleep and eating, then you're out of alignment in so many areas: spiritually, mentally,
Mhm,
emotionally, physically, relationally, financially, and purpose. Because your whole existence is focusing on completing the task. The task is work. Completing the task, feel a hunger that's inside me. Completing the task, um, get the sleep that I'm missing. What are you doing to replenish yourself? What are you doing to relax, have fun, and actually enjoy life? Life is meant to be experienced. If we're existing like grass throughout life, then that's going to be a problem at some point, because when do we realize that action oriented means doing something to focus on the things that we value and believe that's important in our lives? And that's one of the challenges I give to people: develop a personal wellness plan, partner with somebody. But that personal
mhm,
wellness plan has to be is a physical aspect. If they're seeing their provider, a doctor, then is the emotional and mental aspect from seeing me. But then there's a spiritual aspect. Then there's a relational aspect, who you're connected to, and then there's a financial aspect, what are you spending your money on? Is it leading to something that's making you happier, or is it leading to more things that take your attention away from what you need to focus on? And then purpose. Everybody was created for a purpose. What's your purpose? If you could do anything today, what would you do? And trying to get people in a line with that. And because we only get one shot at this, we only get one shot at life. If you're going to get one shot at it, make sure that you live in life to the fullest. And then I use a movie a lot of times to paint the picture that I want people to see. It's called The Secret Life of Walter Mitty. It was this man that was incredibly gifted at his job, but he didn't have anything outside of it. And so one of the things that we talked about today, fear and anxiety, actually led him to discovering how to live. And
mhm,
it's so I deal with so many Walter Mitty's when they come into my office. It's a being still a movie, but I see so I name people characters from movies, and that's how. So instead of giving them a diagnosis, I give them,
mhm,
okay, this is what you're experiencing, because it's easy to digest, something that you see than something that I'm dictating to you. And so, do
mhm,
you have a lot in common with this person? Well, we know exactly what you need to be doing. Um,
mhm,
I use Encanto. I use so many moves. I use Scene 2. I try to put life
Yeah.
in the language that people can digest it, but they can
Mm,
understand it, but then they can challenge themselves to be better, and to be different. And
mm.
different is what you want it to be. So
I
if
love
you
it. Yeah,
had,
go ahead. Go ahead.
if you had to look at the movie that describes your life right now, you would probably think about it, and then you'll know exactly why you think about it that way.
Hmm. That's good. I've never heard, and it's funny because sometimes I'll watch a movie and I was like, "Oh, that's interesting," and that's kind of me or whatever. But I've never like went deeper and was like, "Okay, well then, what do you think they should change, or what do you think they should
Mhm.
do, or why do you think they are experiencing X, Y, and Z?" That's good because it does make it a lot more relationable because you can see it, you can kind of understand it, and you say, "Oh, okay, interesting." Well, listen, I am so full because so much has been dropped today, like freedom and not having to struggle and being able to know that you are not your diagnosis, but there is something that you can do about it. And the first step is awareness. Is there anything else, any other comments that you would like to make on today before we close out?
As always, I appreciate you bringing me on to share this information from a holistic perspective. And anything that we do in life, let's look at it from a holistic perspective, because then we'll we won't miss anything. If we just look at solving or fixing the issue, once the issue is fixed or is solved, then we stop working on it. But
Mm,
like I said, progress never stops. So focusing on our wellness never stops, and that should be a priority that we take serious. Because again, we're not invincible.
yeah. Well, guys, thank you so much for watching. As he mentioned, we want to continue to progress in our life. There's always some areas that we want to improve. There's some areas that are uncomfortable, and we're going to have to start making some of those uncomfortable conversations, uncomfortable look at ourselves and say, this is something that you really need to work on, and then find and partner with that person who you know is going to be able to help you get to the next level, because at the end of the day, I want for you to be well. So I am wishing you healing. And until next time, I will see you soon. Take care.